Afghanistan over the last year. We've trained over 5,000 healthcare workers. We support directly 106 primary healthcare centres and 13 hospitals. We provide full operations support for a 100-bed national mental hospital that has provided care and access for 77,000 patients, and 5 regional level mental health wards providing care for 27,000 people. We support 141 IPD, severe acute malnutrition treatment centres across the country, and 12 drug addiction treatment centres with over 690 beds and 17 mobile outreach teams. We provide 4 inpatient treatment facilities for women and child drug addiction with 190 beds and 6 mobile outreach teams. And we've launched a female-specific opioid substitution treatment clinics in Kabul and Mysore. With regard to the National Infectious Disease Centre, which I was at today, we provide full operational support to that National Reference Centre. Today, I was seeing patients with Crimean Congo hemorrhagic fever, with multi-resistant TB infections, an incredibly dedicated staff. We are currently building an upgraded imaging centre with CT scanning and other diagnostic capabilities. We're upgrading the intensive care unit so the doctors and nurses, both men and women, treating both men and women, have access to a better environment in which to save lives. We're also working to provide solar power and a full solar electrification project for that hospital, which is a major undertaking. This isn't a small primary healthcare centre. This is a full-scale tertiary referral centre, which we hope to be able to produce a significant amount of its own power over the next year. And as I said, in addition to providing full operation support for HR and supply chain in that hospital. We also support over 600 Sentinel acute surveillance sites, which have generated over 1,500 alerts in the last year. Of those alerts of potential outbreaks, 97% have been investigated within 24 to 48 hours. So within that context, you can see the amount of work that WHO with its partners is doing in countries. I just came from a meeting into this meeting. I had a fantastic meeting with our team that works on prevention and response to sexual exploitation and abuse and harassment, and with our team that works on accountability to affected populations and gender-based violence. And these are major issues in terms of our accountability as an organization and ensuring that our partners and everyone we work with operates safely with a clear view that we must first do no harm in operational situations on the ground. More broadly than that, I speak here very specifically because I'm in Afghanistan talking to the elites here in Afghanistan. But I think Afghanistan reminds us of one of the most urgent challenges of global health in 2025. How are we going to continue to engage in countries that are affected by fragility and conflict? How are we going to deal with the intertwining and amplification of climate, of contagion, and of conflict, where countries are moving, and many of the countries here represented today in this health emergency appeal aren't dealing with one crisis. They're dealing with a multiplicity of crises that are continuing to undermine the capacity of the health system to deliver, but we will continue to do so. But in these countries, this is where the mothers are dying in childbirth and before. This is where the children are dying. This is where the high impact epidemics are occurring. This is where the unmet need is. This is the future, and this is the battle we must win. Afghanistan is not the only place we're witnessing this compounding impact of conflict, displacement, climate change, and disease outbreaks. We've seen unspeakable devastation in Gaza and in Sudan and in other places. We're dealing with complex crises that many of the speakers spoke today about in Ukraine, in Yemen, in Syria, in DR Congo, in Myanmar, in Haiti, in Somalia, South Sudan, Ethiopia, and many other places. I have to say with great sadness that our response to these crises and beyond is also further challenged by the blatant and consistent disregard to international law and the attacks on healthcare that continue to grow across the world. Afghanistan mirrors these challenges faced by communities worldwide, as I said, where conflict, displacement, and climate shocks intertwine. We've heard from the DG about the number of people worldwide that require urgent humanitarian assistance, and this includes health assistance. I think you've heard the testimonies of the partners online. I urge you to look at this health emergency appeal, to provide the resources that it needs. So WHO working with our partners, and again, I will state that WHO by itself can achieve very little. WHO working with governments like we do here in Afghanistan, working with partners like we do here in Afghanistan, we can make a huge difference. We can bring the coordination, we can bring the standards and the norms, we can bring the surveillance, we can bring the methodology that allows the work of all of our partners to be amplified in a way that meets the health needs of the people of Afghanistan and the people of the world. Thank you.
Nice to see you on the camera there. And Dr. Tedros, thank you for joining. Tim, welcome, welcome. Kate, thanks for joining.